right, well, November is Diabetes Awareness Month, and according to the CDC, almost 39 million people in the U.S. have diabetes.
But nearly a quarter of those people are undiagnosed, meaning they aren't getting treatment that could prevent long-term health issues. And joining us now to talk about all of this and diabetes prevention and awareness is Dr. Deena. Thanks for being here. What would you say are some of the potential symptoms of diabetes?
Increased urination, increased thirst are some of the common symptoms. Blurred vision. Some people can notice some numbness and tingling in their hands and feet. And one of the uncommon symptoms that most women don't realize is increased yeast infections. I've seen many people present like this to the office, and excess weight loss. So if someone's losing weight and they don't know why, they should talk to their doctor about being tested.
All right, well, that's good to know. We're going to test out some of the knowledge right now.
Okay, we have a game of true or false. First up, eating too much sugar causes diabetes.
Ooh, I'm going to go true.
So the answer is false, but a lot of people...
You don't have to say it was such like yo, you wrong.
Well, very close, I
there.
should say. So I think a lot of people think that, oh, if I eat too much sugar, I must be increasing my risk of diabetes. But the truth is that if you don't have prediabetes or something called insulin resistance, you're not at increased risk for type 2. However, you're right in one way, because there is an added sugar called high fructose corn syrup, which is present in soda and some other beverages that actually independently increases your risk of having type 2 diabetes.
Okay, you heard that, Russ?
Okay.
Always drinking the sodas. Okay, so if you had a gestational diabetes that resolved after delivery, you're still at high risk for developing diabetes in the future.
That's right. You guys got it right.
Yay.
So that is a known risk factor. A lot of women tend to think after they've had gestational diabetes during their pregnancy that they're no longer at risk, but I still recommend anyone with gestational diabetes, even if they're normal weight postpartum, that they check on their hemoglobin A1C at least once a year. That's a blood test that allows you to know, do you have diabetes or not?
Okay, so the next one actually deals with weight. You only get diabetes if you're overweight.
I'm going to go true.
Okay, so Arrianee got it again. So there's many different forms of diabetes. Type 2 diabetes is the most common type, and that's the one associated with weight issues, being overweight or obese. But in fact, there's many other types of diabetes. There's type 1 diabetes, which may have nothing to do with weight and is actually diagnosed when you're younger. There's different genetic forms of diabetes. There's diabetes that can be caused from medications that you're taking. For example, steroids. A lot of people get steroid injections and they get steroid-induced diabetes. If you have issues with your pancreas, which is the organ that makes insulin, you can also develop diabetes related to that as well.
Say if you don't have any of the symptoms for it and you take one of the popular weight loss drugs, can that help increase the chance of getting diabetes?
So it will actually improve your diabetes, right? If you have high blood sugars, these medications are targeting bringing down your blood sugar levels. In fact, I've had some patients who don't have diabetes presenting with something called hypoglycemia, which is low blood sugar values. They feel extremely nauseated, tremulous, and they're shaking in the morning. And that's a sign that the sugar is dropping, probably from that medication. So talk about it with your doctor.
Okay, let's go for our last one. Diabetes is a major risk factor for heart disease.
Great, that's right.
Yay.
So diabetes is a huge risk factor for heart disease. They say that if you have type 2 diabetes, you are 4 times more likely to develop a heart attack or a stroke. You're also at increased risk for chronic kidney disease, problems with your nerves that can potentially lead to problems with your feet, which can lead to amputations. Diabetics are also at increased risk of gum disease, problems with their skin, wound ulcerations, and things like this. So if you are concerned, important to get your diabetes under control and talk to your doctor about how to do it.
All right, 1 in 6 Americans have it. Thank you,
Thank
Dr.
you.
Deena. Really appreciate it. And for more health tips, you can follow Dr. Deena on Instagram. Information right there on the screen, or you can visit diabetes.org.